Hello, everyone. This is Cindy Rubin. I am recording for you this week's episode of Keeping in Touch, where we meet interesting people in the breastfeeding space and oftentimes in the Chicagoland space as well. And this week, we are meeting with Jessica Kerr, and she is a physical therapist, a doctor of physical therapy, and she is one of the founders of Allied Therapy Partners. And she received her BS in kinesiology with an emphasis on exercise and health promotion, and then got her doctor of physical therapy from the University of Illinois at Chicago. She is passionate about all things related to birth and babies and enjoys supporting individuals throughout their prenatal and postpartum journeys. So, welcome to the show. And thank you so much for talking with me today.
Thank you so much for having me. This is so much fun. Every time you and I talk, I always feel like we have really good conversation. So I feel like this will just be another fun conversation we'll have.
I feel exactly the same way. So, why don't
Yeah.
you go ahead and tell us a little bit about what you do and how you got to where you are and doing what you do?
Sure. So I am a doctor of physical therapy and I specialize in pelvic health and also pediatrics. So I started out just going to physical therapy school, not really sure what I wanted to do. I ended up doing a pediatric clinical rotation and really fell in love with that. Also, I had a baby in PT school, so that really had me really interested in knowing how my child is developing. And then from there, also because I had a baby in PT school, I really got interested in pelvic health. However, I did not really start to pursue additional certifications or anything in pelvic health until after I graduated with my doctoral degree.
Okay.
So I started out working pediatrics, really loved it, but just always knew there was something missing. I am a self-proclaimed birth junkie. So I love to talk about pregnancy. I love to talk about postpartum. I love to talk about birth and me really being in love with birth and all that kind of stuff and wanting to make sure that people feel empowered and supported led me more towards pelvic health.
Great.
Yeah. So great birth
That's
junkie here.
I love what you say about just wanting to empower other people. And I think birth is one of those things that we want to have so much control over, but yet there is only so much we can control. So to feel empowered to control what you can and take care of yourself is so important.
Right. 100%.
Yeah. And then you opened your own practice.
Yeah. So it's actually me and a business partner. We both went to undergrad together and then also grad school together. We always kind of knew that we wanted to start a practice. We didn't really know how that was going to look. And so during the COVID era, we decided that we were just going to do that. We wanted to treat the way that we wanted to treat our patients and have a little bit of like freedom in what we're doing with that. And so then that's how Allied Therapy Partners started. So I see primarily pelvic health and pediatric patients, and occasionally we'll see an orthopedic patient here and there. And then my partner, Dan Lincolnow, who's also a doctor of physical therapy, he sees primarily orthopedic patients and then also geriatric patients. And he also sees pediatrics.
So you guys really cover the whole spectrum.
We do mainly because we just have different interests, really in ortho, post-surgical rehab. And I just really love pelvic health and little babies. So yeah, so that's really why we cover so much. But in general, my heart is with the pelvic health and
Right.
peds, and his heart is with the orthopedics and the pediatrics.
Gotcha. So tell me a little bit more about pelvic floor therapy and what it actually is. I think a lot of people hear that term, but don't really know what it entails.
Yeah. So pelvic health physical therapy is therapy that focuses on pelvic floor dysfunction. So sometimes that could be using manual therapy. So that could be like our hands or tools, for example. Sometimes that could be using exercises or activities to help a patient reach a goal that they have in mind. We always do a very thorough examination of the patient on how they're moving. We look at their strength, their coordination, their endurance throughout their whole body, because it's very much connected to the whole body. And then we can also do an external pelvic floor examination, which is just looking at the perineum and assessing how the perineum looks during different activities. And then also we can do an internal assessment, which uses one finger to assess the pelvic floor internally through the vaginal canal. And with that, we can assess a patient's pelvic floor strength, their coordination, their endurance, their timing of muscle contraction, whether they have pelvic floor tightness or not. So all of that same stuff that a physical therapist can assess on the side with muscles can also be assessed internally, either rectally or vaginally. And then one important thing to add is that this is therapy that can heal without using surgery or medication. And it's evidence based. So we don't use surgery, we don't use medication, and everything that we do is 100% evidence based.
That is fantastic. So, depending on what the problem is, it can be really important to get pelvic floor therapy in the hopes that you can avoid something like surgery.
Right. And then sometimes surgery is something that might have to happen maybe down the road at some point if conservative treatment doesn't help. And usually, most of the surgeries associated with pelvic health stuff just fix the symptoms of something else, don't
Mhm.
necessarily the root cause of what is going on with the body.
Right. Gotcha. Okay. Who should think about getting pelvic floor therapy or getting an evaluation? I have a personal story, which is that I had issues going on after I had my first child, and I didn't say anything to anyone because, I just thought that that's just the way it is, which is, I think, what happens to a lot of people.
Mhm.
And then I decided to mention this to my OB when I got pregnant again, and he's like, "Oh gosh, you should have told me about this before you got pregnant, but let's have you go be evaluated anyway now."
Well,
And
they said that because a lot of
yes.
times they don't.
Yes, he did, and the reason why I think some don't, and the reason why it would have been nice for me to go earlier is because once you're pregnant again, like, everything's kind of loosening up in
Mhm.
preparation for your baby coming out. Sometimes you're fighting with nature a little bit, I think, at that time, and there's
Yeah.
potentially a limit to what you can do, but that was how I learned about it, and I wish that it had just been an automatic thing after I had my first baby so that I didn't have to suffer in silence as many people do.
Yeah, that's absolutely right. I think there has been more of a shift recently, like in the last 10 years, where people are starting to realize the benefits that pelvic health PT can offer. And I think that more physicians are starting to become like more aware of that being like an actual thing that people can do to help
Yeah.
some of their symptoms, which is great. But still, I just want to keep getting the word out to everyone things that are affecting your life, whether that started after having a baby or whether that started during pregnancy, those are all things that are not normal. And you can certainly consult with a pelvic health PT to see what can be done to help with that. So, the things that I hear that make me think that maybe a pelvic health PT consult is warranted are pelvic pain. So pain with penetration, just generalized pelvic pain doesn't necessarily have to be like pain with penetration. Some things I hear like, oh, I can't tolerate a speculum being inserted during my annual pap smear, or I can't tolerate it wearing a tampon because it hurts, or any other weird sensation that comes from wearing a tampon or any sort of penetration. Or I can't cough or laugh or sneeze without peeing a little bit. Or, I'm noticing smearing of my poop on my underwear at random times during the day, or any sort of lower back pain or hip pain that is unresolved. So a lot of times I will hear, oh, I've been going to physical therapy for this hip pain for 2 years or something, and it's still not going away. I've tried multiple different therapies. I've tried exercise. I've tried that. And that's clear to me that maybe the one piece that's missing is an internal pelvic floor assessment of some sort
Interesting.
for targeting the pelvic floor in
Okay.
treatment. And so sometimes with those patients, just doing a little bit of internal manual therapy, which we can actually teach them how to do themselves using a pelvic wand, will trigger their pain or trigger that sensation that they've been feeling for years, right?
Mhm.
And it's just nobody ever explored that, you know?
Yeah.
And then other common things that I hear are I had some diastasis. So I work a lot with patients that had a little bit of laxity or stretch of the linea alba, which is that connective tissue in the front that connects both the right and the left sides of the abs. And diastasis is normal during pregnancy. Like 100% of people get
Yeah.
it. And then there is natural resolution to it afterward, but some people continue to have it and it can really impact their life. And then same with prolapse, any sort of descent of the pelvic organ. So that's also another common thing that I see. So feeling a lot of pressure in your perineum or a little pressure in your rectum, those types of things, those are all clues to me that there might be something going on with your pelvic floor.
Gotcha. Okay. And you told me something that I was kind of wrong about and didn't realize. So I have personally only had vaginal deliveries and I'm not an OB-GYN. And I assumed that it was really only vaginal deliveries that ended up needing pelvic floor therapy. And you opened my eyes to the fact that actually C-sections are the ones that automatically should see pelvic floor therapist, whereas vaginal never hurts to get the evaluation, but not
Sure.
everybody ends up needing more therapy.
Yeah, absolutely. You know, one of the really cool functions of the pelvic floor is to work in sync with our core muscles and our diaphragm to manage pressure in our abdominal cavity. So there's always pressure buildup in there whenever we're doing things. Anytime we're lifting things, anytime we're squatting down, picking things up, like anytime we move, there is an increase of pressure within our abdominal cavity, and the pelvic floor works really nicely as a trampoline to kind of like modulate the pressure, right? So if there's too much pressure, it might lengthen a little bit to kind of like try to even that pressure out. And so what happens is that if someone has a cesarean section, there can be a disruption in that whole canister like function of the diaphragm, which is the top of the abdominal cavity, the pelvic floor, which is the bottom, and then all around is the core, which it's been cut into to get the baby out, right? So that disrupts that whole pressure management system. So, in fact, I think everyone with a cesarean section should at least have a consultation for pelvic floor PT because that is all related. And then the other thing is like, oftentimes you only see outside scar, right? But really, there's scar tissue that goes deep into
Yeah.
your anterior abdominal wall. And so sometimes those adhesions can cause pelvic pain. Sometimes there can be dysfunction in how what the nerves are doing and the sensations they're picking up because the nerves were damaged, right? So there's just a lot going on there. But it's like one of the few surgeries that physicians don't automatically say, go get PT after this, which I'm like, but it's a major abdominal surgery. Why wouldn't you? Why should someone who has, an ACL tear or something, why do they need
Right.
PT? But then someone that had like a major abdominal surgery doesn't. There's
Mm,
still joints there in the pelvis. There's all sorts of tissue. There's organs. There's muscle. And so it's just bizarre to me that that is not like more normal.
I guess it doesn't surprise me because I feel like it's just one of those things that the postpartum woman is
Well, like, no one
infatuated.
cares about the postpartum.
Right.
That's the problem, right? Like,
Huge.
oh, cool, the baby's good. Okay. Well, see you in 12 weeks, or like, oh, I
Right.
see you in 6 weeks, And then really having practitioners in there during the postpartum period, especially that fourth trimester, right?
Yes.
Is so important because, I mean, Dr. Rubin, you're in there helping, doing the well checks for the kiddos, doing lactation support, all that kind of stuff. you might be the first person that hears that, oh, maybe they need some mental health support. They're having a hard time. There's just so much screening that is so important in that fourth trimester. It needs to happen. And when they're not being seen for 12 weeks or 6 weeks or whatever, then what's happening during that? There's a lot missing there.
Right. Absolutely. And I'm not knocking OB-GYNs either. I mean, this is a systemic problem.
It's a
Yeah.
systemic thing for sure. I mean, it's the way it's been done for a long time. Men made a lot of these rules back when things were shifting from like midwifery care into like obstetric care. And so, yeah, it's definitely a systemic thing. I think that people are starting to realize that more, though. Consumers are starting to be more aware of some of these things. And I do feel like there is a shift happening, not fast enough, but yeah. Why we're here, right? Because we want
Right.
people the support that they need during that fourth trimester.
Right. Absolutely. So tell me about how you can help with breastfeeding. Is there a way that you can help women who are breastfeeding and having potential issues?
Yeah. So a few things. So let me just kind of rewind a little
Mhm.
bit, still on the same topic. So one of the beautiful things that I can offer any pelvic health PTs that go into the home, in Illinois, we don't actually need a referral for therapy from the physician. There is direct access, which means that if someone thinks that there's a reason that they need a PT evaluation, they can just contact us and we can just go.
Did not know that.
And so what ends up happening is that I'm able to go in there really early on. Someone might be a week post C-section or a week post vaginal delivery, having a lot of trouble sitting or pooping or peeing. Those are all things that I am able to go in there and help with right away. So one important thing is they don't need to wait for that 6 weeks. They don't need to wait for that 12 weeks. There are a lot of things that can be very helpful functionally that I can help with right away. And so what ends up happening then is a lot of times I'm the first one to hear, oh, my back really hurts when I'm nursing. Well, I'm able to actually see, like, okay, show me what that looks like. Let me see the positions that you're nursing in. Let me look at your setup. Let me make some recommendations for positioning of your body, setup of the environment. And then it also helps me like be there to assess the baby too a little
Mhm.
bit. Sometimes I'll hear my child only likes to nurse from my right breast.
Yes.
I don't want
Yes.
and I'm like, let me take a look at the baby. I can also assess for any sort of asymmetries in their trunk, in their neck strength, in their neck range of motion, and just general overall range of motion.
Mhm.
So I can help in that regard. And so I do have a lot of experience working with little babies with torticollis, which does have a pretty big connection, I think, to people saying, oh, my child only wants to nurse from this side. It's really hard
Absolutely.
for my child to latch on this right breast. And then also, there is some exciting research that has come out in the last couple of years that therapeutic ultrasound can be helpful in helping to relieve clogged milk ducts.
Yeah. I was telling Jessica a while ago that I was looking for somebody who could do this for my
Really.
patients, and lo and behold,
And we have been offering it, and we have had a lot of really great success with
it's
it, which is
wonderful.
awesome. Obviously, it's not getting to the root cause of the issue. Obviously, a lactation consultant is going to be the person who can really help get to the root cause, but it can
Right.
certainly help just helping to stave off that mastitis, helping to have the person feel just a little bit more confident about their breastfeeding, not being so fearful that they're going to get mastitis. Some of the
Right.
patients that I work with have recurrent mastitis. You know,
Oh,
it's kind of one of those things where they're super anxious. They're going to get it all the time.
yes.
So even just having this additional resource treatment to help not get it
Right.
just helps them a little bit, you know?
Yes. I mean, we now know that mastitis is
Right.
a spectrum of conditions that can happen in the breast that are related to inflammation. And therapeutic ultrasound acts kind of as an anti-inflammation agent.
Yeah, so it's a way of applying direct heat and also sound waves to help mediate that inflammation. Typically, it's followed up with a sort of lymphatic drainage type manual therapy. But the whole treatment itself really only takes like 30 minutes. And it consists of just getting a good intake from the patient, making sure they don't have any sort of current infection, getting the history. I mean, just like any other assessment. that I would do on anyone, just making sure that I have the full history, and the therapeutic ultrasound, and then it's followed up with some manual techniques using my hand.
And seeing a lactation professional
Yes,
as well.
always. I have never had anyone actually come to me that wasn't already seeing one. Therapeutic ultrasound is not gonna solve the problem, is not gonna take care of the root cause.
Right, right, but a wonderful resource to have and not
Yeah.
always easy to find somebody who does therapeutic ultrasound for
Right.
this kind of thing,
And what
really.
I was actually gonna ask you about, I know there's been a recent change in the mastitis management in that, like, it's no longer heat, it's now ice, it's now anti-inflammatories. I suppose that protocol might be changing in the future if the warm compress isn't.
We definitely need more evidence. It
Right.
takes a while sometimes for the research to catch up, and medicine is an art as well as a science. But
Right.
whenever we have the evidence, it is helpful to use. So that's an interesting point, and it'll be interesting to see if that changes over time.
Right, and then when we have the new evidence, and they're gonna be like, "Nope, that's all wrong."
Right. Exactly,
We're coming in with
exactly.
new evidence.
It's always changing. Absolutely. Well, this is so, so helpful. So it is really important for peripartum women to know what resources are out there because I'm always telling them you have to build your village and start thinking about it before that baby comes so that you have all of those support people at the ready. And you don't always have to wait for something to go wrong either.
Right,
Um,
yeah. Oh, I have a great story. So I actually started working with a patient, and her husband actually reached out, and, like, his whole thing was, "Oh, my wife just had a cesarean section 4 days ago. How soon can you be here to start helping her?" And I just
wow.
loved that. I was like,
Yeah.
"Gosh, you're the coolest person that I've ever met." It just made my heart so happy to hear that her
Yeah.
spouse was, he was just on it. He knew that she was
Right.
gonna need help. He just reached out right away. That's really how it should be. One thing I know, I have a 5-year-old and a 16-month-old now, but those early days, man, they can be really alienating, lonely. You're so vulnerable. You need people just like doing things for you and
Mhm.
telling you what to do, like telling you to sleep, telling you to eat, bringing the baby to you. And I know you offer this, which is awesome, the 4th trimester package.
Yes.
I think really starting to highlight the importance of all of these services in the 4th trimester is so important. And so, like, when people are saying, "Oh, what should I get this new mom? She's having this new baby. Oh, cool. I'm going to get them this Ducaton or this or that." No, get something that is actually going to
Yes.
be useful for them, that they're going to need, like, really
Yes.
need.
Yes.
Different support, no matter what their goals are with that. Pelvic health support, postpartum, might even be pelvic health support during the prenatal period. All of that. That's really the stuff people need.
Yeah, you're totally right. And if you're watching this and thinking about, oh, maybe that would be an interesting gift, most practitioners can figure out a way that you can gift these kinds of professional services. Not always, but there are ways to do it. So always worth asking.
Yeah, for sure.
Great. So, on a slightly different subject that I always want to talk about, these are my two questions that I ask everybody. So, what is your favorite thing to do or your favorite thing about living in Chicago?
Oh, my favorite thing. Okay. So my favorite thing to do is always going to be running. I love to run. That's my ultimate favorite thing to do. And my favorite thing about Chicago is, well, there's two favorite things. Is that
Okay.
okay? So just the variety of food that we have here is amazing.
That's
I used to live in Cincinnati, and there's hardly any, like, you got an Applebee's or a Texas Roadhouse. You might get like one restaurant that popped up is like all the rage
right.
temporarily, but you just don't get the culinary diversity that you have here. And then on the other side of things, just the diversity in general that Chicago has to offer. Like, My daughter goes to a dual language school, which is really important to me because I grew up speaking Spanish. And so my husband and I always think about, oh, what if we were to move to Michigan someday? Because that's where he's from. And the first thing I did was like Google dual language schools, right? Then where he grew
Yeah,
up. I'm like, I
yeah,
don't know. That's not really in line with like what I
yeah.
want. So the diversity of the people really and the cultures and the languages that we have here in Chicago is my favorite thing.
Very cool. So, okay, wonderful. And number 2, if you could go back and talk with your 20-year-old self, what would you tell her?
Oh gosh.
I know I didn't tell you about these ahead of
My
time
20
because
year old son. I'm not really sure about that. What was I even doing when I was 20? I would
so
say, like, don't get so obsessed with like always being plugged into things. I think it's hard as a business owner because you're always trying to like get the word out about your business and everything. So I end up being really connected to social media. At the end of the day, I'm like mentally exhausted because I was on social media so much. And so I would tell myself to don't become that always attached to something, right? Like
right.
a phone or a screen or some social media account or something. Because I do feel like that really takes away from me being able to just like enjoy the little things in my life. So that's what I would tell myself.
Yeah, that's very good advice for everyone, even the non-20-year-old, even the
Right.
50-year-old.
That's
Yeah, because it is hard, especially when that's how you get things done
yeah.
now.
When I
Yeah.
was 20, MySpace was there and that was so cool at the time. And now people are like, what's MySpace?
And you can kind of tell how old somebody is from what their favorite platform
Mhm.
is. I'm a
Right.
Facebook person myself. Well, so tell us how somebody can find you if they are interested in using your services.
Yeah. So you can go to our website, which is alliedtherapypartners.com. There is a contact form on there. So you can reach out to us there. You can call us. Contact information, again, even for our phone number, is also listed on the website. You
Okay.
can also go to our Facebook page, which is just Allied Therapy Partners. I think really the best way to get a hold of us is through the website. Generally, we try to get back to everyone within 24 hours. Or if you are not in our area, we also offer telehealth. So if you wanted to take advantage of a virtual appointment, we could help you out like that as well. Or we're also happy to refer out to other pelvic floor PTs if you need something that is outside of our area. You can also find pelvic floor PTs at pelvicguru.com. That's a resource that I like to recommend to people. We're here
Uh,
in your home. We can be
yeah.
extra helpful, I think, because we do offer that service.
Especially imagine you can't drive right after having a C-section.
Right. You have a newborn. I remember I was so
Oh, yeah.
stressed out about even leaving the house with my
Yes.
newborn.
Yes. Me too.
Like, that one stressed me out so much. Or, like, other kids, like, I don't care if there's kids there during our session.
Mhm.
Still get you're there. Will still happen, and it's only more realistic and more fun when your kid's there.
That's
So
true. That's true. And speaking of kids, just an important thing for people to know is you also are an early intervention provider, correct?
I am, yeah. So I do
Yes.
see children privately, and I also see children through early intervention, and so does Dan, the other
Okay.
co-owner. So that is a service that we offer, and we love working with kiddos, and we have a good connection to other providers as well in early intervention. So we're able to be a resource for that as well.
Great. Great. Well, thank you so much. I think this is absolutely essential information for people to know about. And I'm so excited to have you in my village and to be able to refer to you and share patients.
Dr. Rubin, it has
Yes.
really been such a pleasure. Thank you so much for having me on here. You and I are on the same wavelength. We're on the same team. You know, we're all about just helping people out, right? We just want people to feel good, be able to connect with their families and do all the things that they want to do postpartum and all that kind of stuff. And so that's what I think is great about what we offer.
Yes, absolutely. And I'll put all the links in the show notes. And feel free if you are watching this on a replay, you can put questions into the comments and we will get back to you with answers when we can. So, everybody, thank you for joining us on this week's episode of Keeping in Touch. And thank you, Jessica, for joining us and have a good week.
Thank you.